Did you know that one use of a substance can possibly lead to an addiction within 2 years of the first time you use it? Gentlemen, did you know that cocaine can make you infertile? If you knew sudden death was a side effect, would you snort that line? Well, today I'm here to inform you about the effects of cocaine addiction and abuse. I will be informing you about the background, sharing some facts, explaining the effects on the mind and body, and at last, how to prevent, diagnose, and treat cocaine abuse and addiction. Now let's get started. First, I'll share just a bit of information on the background of the substance cocaine. Cocaine comes from the cocoa plant, which grows in South America. Cocaine in solid form you can make cocaine from solid form by mixing cocaine with baking soda and water. Rock cocaine is placed in a crack pipe and smoked. When mixed with water, it can be injected. When powdered cocaine is mixed with heat and heated, a gas which is highly flammable is released in pure form and then inhaled. Cocaine has several street names, which is what it is referred to. Here are just a few: Coke, nose candy, snow, blow, toot, or flake. Crack cocaine, which is a solid form of cocaine, is known on the street by rock cocaine. Cocaine is a stimulant drug. Cocaine can be snorted, injected, or smoked. Now for some facts about cocaine. According to the article written by Roxanne Dryden Edward titled "Cocaine and Crack Abuse," 25 million individuals will use cocaine at least once in their lifetime. 2.4 million people use cocaine twice a week. 5% who use cocaine once end up developing a dependency in 2 years. Between the years 1990 and 1999, $70 billion was spent on cocaine. People who are addicted are at a higher risk for suicide, homicide, domestic violence, or risky behaviors. Individuals who abuse or are addicted to cocaine have a psychological addiction. Mental disorders are caused by cocaine use, such as depression, anxiety, bipolar disorder. Personality disorders are also caused by cocaine abuse, such as antisocial personality disorder. When consumed with alcohol, a substance is produced in the liver called cocaethylene, which is a greater risk of sudden death than cocaine alone. Also, cocaethylene intensifies cocaine's euphoric effects. Now that we have covered some background facts, let's discuss the effects of the substance. The effects of the substance depends on the amount of intake of the substance. Some symptoms of cocaine abuse are recurrent, occurring in potentially dangerous situations, interferes with important obligations, resulting in potential social and relationship problems. Symptoms of cocaine addiction are gaining a tolerance of the drug, with withdrawals from the substance, persistent desire to use it, unsuccessful efforts to stop, neglecting aspects of life, spending too much time and energy getting, using, or recovering from the cocaine. The high you get from cocaine is intense pleasure, then becoming hyperactive and very alert. Once the high wears off, an individual can become agitated, irritated, and very uncomfortable. Cocaine overdose causes anger, aggressiveness, violence, psychosis, and homicidal thoughts and behavior. Decreased inhibitions is also a factor of cocaine overdose. Also, individuals who use and abuse cocaine itch a lot. They think things are crawling on their skin, which is paranoia. A few of the medical risks are the tearing of the major artery, which is your aorta. Strokes can occur because of extremely high blood pressure and high body temperatures. Heart attacks are also a risk of cocaine use. Children who are exposed to this substance will have trouble paying attention and will have trouble with their memory. Some physical risks are decreased appetite, sleep deprivation, and male infertility. Long-term effects of cocaine addiction and abuse are malnourishment because of decreased appetite, loss of sense of smell from snorting, chronic runny nose, increased risk of contracting HIV and AIDS and other blood-borne diseases from injecting, and paranoia can occur in which they lose touch with reality and experience hallucinations. Some effects cocaine has on the brain are increased doses to try to achieve the pleasure of their first time using the substance becomes very highly addictive and disrupts communication. When crack is smoked in solid form, it takes seconds to feel the effects. When snorted in powder form, it takes 10 minutes to feel the effects. The high wears off in less than 20 minutes. When withdrawals from the substance take place, sudden drop in blood pressure or pulse, severe depression, suicidal thoughts and behavior occur, irritability, suppressed appetite, sleeping problems, and cravings for the substance. Now you know some of the horrible effects of cocaine. I'll tell you some ways to prevent cocaine abuse and addiction. Causes and preventions of cocaine are few, although there is a couple. There is no single cause of cocaine abuse or addiction. Many biological, psychological, social risks increase the likelihood of abuse or addiction. Professionals recognize a genetic aspect of cocaine addiction. Substance abuse is increasingly higher with families because of the addictive environment. Prevention of cocaine addiction has to do with receiving appropriate supervision, having an understanding that cocaine use is unacceptable. Next is looking for symptoms and abuse of addiction. Signs and symptoms of cocaine addiction and abuse are sometimes hard to spot. Destructive patterns of use that leads to problems and distress. An individual's work or school performance starts suffering. Larger amounts are taken because of the individual's tolerance for the substance increasing. Unsuccessful attempts to control or decrease use. Withdrawals from the drug. Continued use despite the ongoing suffering of the physical or psychological problems caused by the drug. Next is this tricky step of diagnosing an addiction. Cocaine addiction cannot be diagnosed by a single test. Health providers look at medical, family, and mental health information. Physical examination, lab tests, quiz, or self-test to screen for substance abuse. Symptoms of cocaine abuse can be the same as some mental illnesses. A disorder that deals with sudden behavior changes, mood, or thinking are particularly difficult to distinguish from cocaine abuse or an addict. Next is the treatment for the addiction or abuse. Treatment is available for people who are addicted or have abused cocaine, although less than 40% receive treatment for their addiction. Abstinence, relapse prevention, rehabilitation are keys to detoxification. A person may have to have help lessening the effects of the cocaine withdrawal. Detoxification is usually performed in an inpatient center or hospital. The psychological addiction is the most time-consuming part of the recovery process. Support from family and friends are very important. Relapse is very possible even after long periods of abstinence. Now you have a better idea of what cocaine can do to your body and mind. Now you will be more aware of what you can be risking if you snort, inject, or smoke any cocaine. In conclusion, after hearing all these facts and scary effects, would you still be willing to snort that line? Put yourself in that kind of danger? Remember, most cocaine addicts go untreated and go on to live life with these horrible effects. Would you want that?